Where should you put the tattoo in relationship to the lesion? If you're going to be referring to surgery, I think it's best to mark typically the distal side. Some colonoscopists mark the proximal and distal sides. That's really unnecessary, potentially confusing. The surgeon has to identify two sets of tattoos. So just make it simple, be consistent, put it on the distal side, usually 2 to 3 centimeters from the lesion and in 3 to 4 quadrants. And then document that by photographing the completed tattoo, which usually will show the lesion immediately proximal to the tattoo, and say in the report where you put it. For example, this lesion was marked immediately distally in 4 quadrants with a total of 4 ml of spot. Okay, so let's demonstrate in real time the marking of a colorectal cancer. You can see a fairly flat colorectal cancer here in the left colon, and the optimal location is distal to the tumor, usually by a distance of 2 to 3 centimeters, which sort of puts us around a turn. We can't really see the tumor very well anymore. And we are going to use the bleb technique, and we want to mark the colon usually in 3 or 4 quadrants so that the surgeon can easily see at least one of the tattoos. From the peritoneal cavity, we're going to get on the anti-mesenteric side of the tumor with at least one of these injections if we make a ring all the way around. I like to try to keep the tattoos at the same level. Some people seem to get them spiraling down the colon away from the tumor with the injections more and more distal. So try to use the initial injections as a marker so that you sort of end up with a ring that's pretty much at the same level. The bleb technique here is allowing us to be sure that we're going to get into the submucosal space. Right now we're a little bit on FOS with our bleb injection. We're using saline here, putting about a cc in for each bleb. I like to just put all of the saline in first so that when we're finished we can flush the catheter with spot and start right in putting spot into each of our saline blebs. In this on FOS position, if you just sort of poke a little bit and then pull back on the needle to see if the needle is in that submucosal space, you can often see the actual shape of the needle. And there's our nice submucosal saline blebs, and now we've flushed the catheter with spot, and we're going back in and putting 1 cc of spot into each of these initial saline blebs, and then that's going to finish the job for us. Once we're finished, we will take a photograph of the tattoos. Hopefully the tumor will be visible in there, but we want to demonstrate that we've done a good job. We're now going back to our initial saline blebs and getting back into those to put a cc into each of those spots. And then we're going to document that we have injected 4 mLs of spot in 4 quadrants immediately distal to the tumor. And that will be all the documentation that we'll need to make sure that we get the correct segment, including the tumor, removed at the time of surgery. So proper technique and location for tumor marking.